Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. You can call us, and lines are open for you right now at 866-870-5752 right here in the studio. Check out the website at www.lastemcells.com. That's lastemcells.com. And right now we're speaking with Alexander in Porter Ranch.
So, Alexander, we're getting a lot of calls in here. So is there anything else you want to tell us about your knees and your shoulder from playing volleyball?
Yes. I wanted to give you an example of my worst-case scenario, and just to make sure that you feel you can help me.
I'm listening.
So once a year, I travel back to Ukraine. That's where I was born. And on that flight, it's the worst time of my life because, obviously, I do fly a regular coach, and then, 10 hours.
Can I answer your question already? I have the answer. You ready?
Okay.
Yes. When someone has patellofemoral syndrome, which we talked about in the first half of the show, I don't know if you're listening, that's where the cartilage behind the patella is worn out from jumping sports or excess running. The experience they have is what we call the theater sign, like you're sitting in a theater cramped up, or an airplane sign. And the knees ache like crazy. So that's what we call pathognomonic, meaning that is the diagnosis just from what you've told me already. I'm guessing you have a lot more going on than just that, but I'm guessing that the back of the cartilage is worn out, and we can help regrow that. So that's the answer to that question, Alexander. God bless you, and we're going to go to Patrick in Pasadena. Hi, Patrick. Dr. Marc Darrow. Can you hear me okay?
Hi, Patrick. Are you there? Hello, Patrick.
Hello. This is Patrick.
There you are.
Yeah.
I'm sorry. I'm driving. I bumped into your show. Enjoy it very much. Hopefully we won't get disconnected.
Hopefully not. Are you on a Bluetooth? If you are, please get off of it so we can hear you clearer.
Yes, I am. Will do. Okay, is that any better?
Oh, much better. Thank you so much. So the back of your knee hurts. It's hard to walk. You have pain. How long has that been going on, Patrick?
It's been going on about 6 months. I'm 57, about 40 pounds overweight, and a young cross trainer decided to help me after I did him a favor. So next thing you know, I'm in a cross-training gym doing squats and stuff I haven't done since college.
Oh, my God. I'm sorry I'm laughing, but the same thing happened to me.
Well, maybe we can compare notes afterwards to see if it's the same trainer.
Exactly. The
pain was so bad I couldn't sleep at night, and I finally mustered the courage to go to an orthopedist. He took 4 x-rays, but mysteriously a day before my appointment, the pain, 90% of the pain had gone away.
Okay,
and
that's
I
good.
almost canceled the appointment, but I followed through.
Yeah, right. And?
He said you probably had a Baker's cyst, and you should be okay, and then left me on my merry way. Well, the pain is coming back progressively. Some days are worse than others. The pain radiates from the back of my knee into my calf and up the back of my leg. And again, sometimes it's just debilitating. It just can't even sleep. Other times, I'm walking around and I know it's there and it's a nuisance.
Okay. Did the orthopedic surgeon use an ultrasound to look at your knee?
Negative.
To look inside?
No, not an ultrasound, just shot 4 x-rays.
Okay, so the first thing I would do is put the ultrasound probe on the back of your knee and then on the front of the knee to look for fluid. A popliteal cyst, or as you called it, a Baker cyst, is just fluid in the back of the knee. Easy to take out with an ultrasound, dangerous to take out if you're not using an ultrasound, because there's a big artery back there, the popliteal artery, and if someone hits that, they can kill your leg. So we use an ultrasound. I use an ultrasound on knees and hips, shoulders, and occasionally other parts of the body where I need to. But it's very dangerous to inject without that. So oftentimes when there's a problem with the knee itself, in the front of the knee, and there's fluid buildup, synovial fluid, there's nowhere for it to go, so it pushes into the weak spot, the back of the knee, and then people get these cysts. Just yesterday, I took out about 40 cc's. You know how much that is? That's a lot. 40 cc's out of the back of a woman's knee. And when I finished that, which takes a second to do it, she was like, "Oh, thank you, that feels so good." So that fluid can be what I'm going to call a space-occupying lesion. It can keep your knee from moving and cause a lot of pain. But I have to examine you, I have to look with the ultrasound to really know what's going on. The x-rays won't show a whole lot because they show bones. They don't show the soft tissue, and they don't show fluid very well. Okay?
Okay.
Any other questions, Patrick?
No, that was very helpful. Let me retract that. I do have a question. Is there a propensity for this to continue to happen if you were to drain the fluid, if that was the issue?
Yes, draining it in and of itself. Go ahead.
What caused it to begin with, and do I have a propensity for recurrence?
Okay. Once a person has fluid in their knee like that, and it's aspirated, it usually will come back unless you treat the joint, in this case your knee, with regenerative medicine to help heal it. Okay? So when we heal up the problem causer, the fluid stops being produced. People come in and they go, "I've got why do I have all this fluid in my knee?" And it can be from several reasons. If you tear an ACL or meniscus, it can be blood, which needs to come out immediately so it doesn't clot in there and take forever to heal. It can be synovial fluid, which is just from irritation from arthritis and other things like that. There are 3 layers of synovium. Those are layers of fluid-producing cells around the joint capsule in the knee. So if it's irritable, it's like if I scratched your eye, you're going to keep tearing rather than just producing one little tear to lubricate the lids. Does that make sense to you?
Yeah, it does. Makes a lot of sense.
Okay. So when I take fluid out, when I aspirate a knee or shoulder, hip, whatever, I'm going to treat the area right then. We actually keep the needle right there, unscrew the syringe with the fluid in it, and screw in another syringe with the PRP, the platelet-rich plasma, or the stem cells right then. So it's like boom, boom. People don't even know they had the treatment done. It's that fast. And it's all done under ultrasound guidance, so I can see exactly where the needle is going and see every drop of fluid that needs to come out and watch the new fluid, the cells, going back in. I typically do maybe 15 of these a day, sometimes more. So I'm doing it all day long. I think I probably should get some roller skates because I run from office to office doing these procedures. So I always counsel people when they call up or they email me, make sure that the guy that does this for you or the woman that does it for you, the doctor, not the nurse, and not a guy who doesn't do it often, does this all day long. It's like you're not going to go to a surgeon to do a procedure who's done a few of them once in a while. I always counsel patients, no matter what doctor they want me to send them to, if it's for their kidneys or whatever, go to the guy that does the most of it. Go to the expert. I had a tumor on my adrenal gland many years ago, and I traveled all over the world to find the right doctor to operate on it. The guy that down here that I talked to a few doctors down here. Most of them never even done one. The ones that had done maybe one or two. I found a guy up in San Francisco who I adore. At the time, he had done about 350 of them. It was a very dangerous surgery. He's the guy I flew up and had the surgery with, and he did an amazing job. Having it done down here, guess what? I said, how are you going to do it? They said, we're going to cut you stem to stern. And I found a guy who did it endoscopically. That means with a little hole. So I had no incision. You got to find the right guy with whatever doctor it is you're doing. Always find the guy who does the most. That's the biggest criteria. You don't have to like him. You don't have to think he's nice. But find the doc who does the most of what it is you're having the problem with, and you'll get good success. And then ask them. Don't be shy. How many of these have you done today? How many did you do last week? How many last month? How many last year? Don't be shy with doctors. They're not above you. You know, you deserve the best you can get. So be careful. Make sense, Patrick?
Makes a lot of sense. I'm so glad I bumped into your radio program. I will be calling when I get to my office on Monday and make an appointment with you. God bless you, Doctor.
God bless you too. Thank you, Patrick.
Thank you, Patrick.
And the number to the office for those of you that don't get to us during the show is 800-300-9300. 800-300-9300. And if you want to watch me do these procedures on the internet, you can look at my website. There's a ton of different videos of me doing these procedures all over the body at www.lastemcells.com. That's www.lastemcells.com. Watch the video, see if it's something you want to do. And then on every page on my website, and it's a huge website, it's very instructional, you can email me from any page there, and I'll answer you that day. All right, Patrick, we're going to go to Ruth.
Okay, Ruth in Calabasas.
How are you, Ruth? You with us?
I'm not doing too well.
I'm sorry to hear
can
that.
Can you speak a little louder? I can hardly hear you.
I'm screaming right now. How's that?
That's much better. Anyway, last September, got up from a chair and my leg gave out on me. I'm a woman in her mid-80s, live alone. I was doing walking, lots of walking, yoga for seniors and so forth. So my son took me to emergency, and I found out, not at that particular visit, but going to a, what do you call him? You just named him.
Orthopedic surgeon?
Orthopedic surgeon. He said, at your age, I wouldn't do surgery. He says, try physical therapy, which I did for several weeks. Didn't help at all.
Okay.
I went to another physical orthopedic surgeon. He did aspirate the knee, gave me cortisone injection, which helped for a while, but then, stopped working. I went in again. He aspirated it again and gave me hyaluronic acid gel injection.
Right.
Okay. That didn't help. In fact, I'm at the point where I'm walking with a walker. Then this last
May I respond to some of these before I forget everything you're telling me? Give me a chance to explain what's going on. Number one, the aspiration does no good, as I was just talking about, aspirating fluid from knees or what other joint you're talking about, and then putting a steroid in. That does no good, okay? It actually hurts the cartilage. You look up on the internet, look up cortisone, and see what it does. It disintegrates the joint. So I know that it's the traditional medicine thing to do, so I can't balk at it, and I can't balk at them, but I don't do it. And,
I can balk at it if it doesn't help.
No, it's a temporary thing, and then in the long run, it makes you worse. And then here's the other thing that doesn't make sense to me. Why would you aspirate hyaluronic acid out of the knee? That's that fluid. It's hyaluronic acid. and then put it back in with the medicine.
I don't know. I didn't know that.
I don't know either. I don't know either.
And then this
that
last
doesn't make
time,
sense.
he took he took an X-ray and said it's bone on bone now, and he gave me an injection of Celestone, Celestone.
Celestone is the same thing as cortisone.
Okay.
In medicine, ONE is a steroid, testosterone, progesterone, estrogen. There's different names for that.
Dr. Darrow, I saw you many, many, many years ago, and I know you helped me, and I don't remember for what condition, and I've heard you on the radio, but I live quite a distance, and since I'm alone, it's hard for me
it's tough to get
but
there.
I will.
Yeah.
And I asked him about PRP, and he says, well, I don't know if it's any better than any of these other things, but you know what? I've got to try it.
Well, look, if you're an orthopedic surgeon, stick to orthopedic surgery. And if you're a regenerative medicine doctor like me, stick to regenerative medicine.
Yeah,
so I don't do the surgeries.
Now.
Yeah, and he shouldn't be doing PRP or knowing about it because he doesn't do it. And I don't know any orthopedic surgeon, and I know a ton of them, but I don't know one of them that thinks that PRP and stem cells are a good thing because they don't do it. And if you're not up on something, you're down on it.
Right.
Does that make sense?
Absolutely.
It's not that they're bad guys. I love the surgeons.
No,
they do the hardest work in medicine.
I mean, I like him, but as I said, I don't care if I like him. I don't want to be in pain.
Well, I hope you like me.
Well, I've liked you all these years and listened to you. Now, will PRP help the condition of bone on bone in the knee?
You don't. First of all, you don't have bone on bone.
Oh, well, that's what I was told. Okay.
That's you know what a bone on bone means?
No, I just heard.
It means I want to do surgery on you.
Hey, he didn't mention it.
You don't have bone on bone because bone on bone is like two bricks next to each other. You can't make them slide. If you're walking with the walker, you don't have bone on bone. It's that simple.
Okay.
Sorry.
Well, I'm very happy I called you. I will call your office and make an appointment. Is there someplace I can park close to your office?
Well, it'll cost you an arm and a leg. You park in the office. All medical buildings are expensive.
Okay, I've just forgotten. It's been so many years ago since I've seen you. I will be there. Just remember
Or you can park a block away and take Uber.
No, I'd rather park down below. Okay, I'll see you soon.
Ruth, I'm going to bet you anything that we're going to help you. I'll bet you, just from what you're telling me.
You don't even have to bet me. Just do it.
Well, whatever it is, I can't promise you anything. I don't promise patients anything. I make everybody sign it.
Promise anything in life.
No, I make everybody sign a consent form saying there's no guarantees in medicine. So that they don't come back at me, because I've had people say, you promised this and you promised that. And I said, I never did. I never said that. And then they get mad at me. There's no promises in medicine. I don't care what you do.
There's
any medicine, any surgery. No, there's no promises in life. But we do studies on all our patients, and most people get better.
Yeah.
We don't heal everybody 100% because they don't want to do enough treatments. You know, it's an inconvenience to heal.
I will be happy to do enough treatment, anything to get back, to being...
Well, Ruth, you sound lovely, and I can't wait to see your face and remember who you are.
Okay. Well, I'll remind you when I get there. And is anyone in the office to make an appointment today?
Yeah, you can call right now. They're by the phones at 800-300-9300. 800-300-9300.
Okay, very good. Have a good day.
Ruth, God bless you. You sound amazing. I can't wait to see you again.
You as well. Bye-bye.
Thank you.
Hey, that's my first blessing of the day. Thanks, Ruth. I feel good.
That's great. Well,
it's funny.
Blessed.
I say, I know that, but it's nice to hear it from someone else. I feel their energy. As my patients leave, I always say, God bless you. It's a habit. I don't think about it. And every once in a while, like Ruth just did, they'll say, well, God bless you. And it really cheers me up. I'm not a religious guy, but I like God. I like the Force. I like whatever you want to call it. I like spirit. I like energy. I don't care what you call it. But anytime someone says, God bless you to me, I feel that energy, and I feel great, and it's a reminder to me that we're all spiritual beings.
Well, I wouldn't argue with anything you just said. I'm right there with you. And we do have a couple minutes left and some lines open. So if you want to give us a quick call at 866-870-5752. That's 866-870-5752 is our number. And lines are open for you right now. Check out the website at www.lastemcells.com. That's lastemcells.com. What do you think?
I have a very quick question here.
Okay.
That I'm laughing at inside as I'm reading it. The person writes, MRI has been performed. Would like to receive a second opinion. I love that, because an MRI is not an opinion. It shows things that are not necessarily the pain generator. Okay? I know that doesn't make sense. We've all been guided to believe that the MRI tells us what's wrong with us. So many studies have been done with people that have zero pain. They do an MRI on them and they find terrible things inside. What does that tell you, Nita?
Well, it's a picture. It's a snapshot in time. But it doesn't
tell us where the pain is being generated.
Only the person in pain can say the pain is here, the pain is there. But a picture doesn't
that's
tell
right. The patient can say where it hurts, but the doctor has to find out where is the pain being generated from. How do we do that? We use our hands.
You have to touch
That's
the
my
area.
MRI, my hands. You have to touch the area. And I say this on every show. Many people come in with a failed surgery. That means they had a surgery, they got worse. Okay? I say, did the doctor ever touch you? No. You mean the doctor did a surgery and didn't touch you? No, he looked at my MRI and told me what had to be taken out. That's not the way in my book to be practicing medicine, because we all know as doctors that MRIs don't tell us what is going on. They show things that are not real, and they show things that aren't there. They're overly sensitive. So be very careful not to ever do treatment, and especially surgery, based on an MRI. If it's a broken bone or something like that, that's great. But not for the soft tissue stuff, not for the arthritis, not for all these things that we treat with platelets and stem cells. You got to touch the body and see what's going on. So be careful. There's way too many surgeries that are being done today. They don't need to be done for the most part.
That's true. They don't. But it's hard to break an old paradigm. That's why we're here.
Well, it's being done. It's changing.
Absolutely.
So here's another quickie question for the next couple minutes that we have left. Had bad shoulder pain for many years. Okay. Shoulder's very complex. It moves. That joint moves in more directions than any other joint. It's got the rotator cuff of 4 tendons that hold the humerus, the arm bone, in place. It's got the joint, there's a couple of joints, actually, the glenohumeral joint and the AC, the acromioclavicular joint. I had a woman come in yesterday with AC arthritis.
Oops.
Oh, go to the website. Watch me do these injections, www.lastemcells.com. If you want to catch me at the office, call 800-300-9300. God bless you, everyone. Thank you so much, Nita.
Thank you, Dr. Darrow.
Thank
you, Alex. Thank you, Suzette. Thank you, everybody. Listen to our friend Warren Eckstein from 11 to 1 every Saturday right here. I'm Nita Valens. Thanks for listening.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.